Hello brain shakers, welcome to today's session. Your host here, Brave Alice, and we continue looking at hypertensive disorders of pregnancy. In this particular session, we are going to be looking at the investigations that can be done, or some of the tests that can be done, or how you would be collecting information as well to help you arrive at a diagnosis of a hypertensive disorder during a pregnancy. So let's quickly get into today's session and look at some of those important tests that you would definitely be running. Now, as you're looking after any woman that walks in, definitely you would want to collect some history as well. So history is very important because it gives you an understanding of what this particular woman is going through, and it also gives you an understanding of the duration from the onset of the symptomatology as well. So now we are looking at some of those tests or investigations. So we will say investigations here, or some of the tests that can be done when you are looking at hypertensive disorders. And number one, we will be looking at history. We've already made mention, in as much as it may not be a test, but history is very important. So we are definitely going to be doing our history taking here. And as you do your history taking, it will tell you, it will elicit information such as this particular woman having had hypertension prior to them even coming in during your pregnancy clinics, or having been on a treatment, and I'll tell you the type of medication that they are taking. They may give you also a history of having developed preeclampsia or eclampsia in their previous pregnancies. So history taking, in as much as it is not an investigation or a test, it is very paramount for you to understand and then arrive at making a proper diagnosis of a hypertensive disorder of pregnancy. Of course, you would also want to do some physical examination. Okay, now when we were looking at the classification, obviously, of hypertensive disorders, we mentioned about the raise in the blood pressures and also the presence of proteins in urine. We did not mention the existence of any edema, because we understand that in normal circumstances with pregnancy, edema also comes in. But even as you do your examination as well, you may want to see the extent of the edema. You want to see the localization as well of the edema. And as you do your physical examination, there are a number of things that you would want to listen to. There are a number of things as well that you may want to actually elicit to help you in coming with the diagnosis of that hypertensive disorder of pregnancy as well. So look at the clinical picture or presentation of your patient. Then you can have what we call urinalysis. So in as much as it is a simple test and a simple investigation that you're going to do, urinalysis plays a key role in the identification of disorders of pregnancy, because it is from urinalysis that you are going to elicit the presence of proteins in urine. Then you can then later send a sample for further analysis, where you can check for the ratios between protein and creatinine, and especially the albumin and creatinine ratios as well, that can be ascertained when you do further tests of urinalysis. So urinalysis, very important. It will tell you the presence of proteins in urine. It means that those larger proteins that in the normal and actual sense are not supposed to pass through the Bowman's capsule now are passing through, and then you end up seeing them in urine. Another test that you can do, whilst we are still talking about urinalysis here, is a test that we call a UPCR, which is just basically urine protein creatinine ratio. So as you look at this, you don't want anything above 30, because if you have anything above 30 here, then it means that you're already dealing with a preeclampsia. So you want to send, when you find a plus of protein in your urine dipstick here, you want to send that sample to the lab for further analysis, so that you can try and estimate the ratio. What is the ratio of protein to creatinine creatinine in the urine that you have actually submitted. So this one plays key role also in the diagnosis of that hypertensive disorder. Now, around about the 20th week to about 34, less than 35 weeks, somewhere here, you can do another test that we call the SFLT1 and PLGF. So this is just soluble FMs like tyrosine, kinase 1. That is what the SFLT1 is. And then the PLGF here is just a placental growth factor. Okay, so that's just a placental growth factor. So this SFLT1 and the placental growth factor, you can actually evaluate what the ratios are. So for a placenta that is oxidatively stressed, it will then start producing the SFLTs here. Okay, so once you have the SFLTs, usually they're going to be in elevated amounts, and when you're looking at the placental growth factor here, which should be measured in picograms, anything less than 100 picograms here then would be indicating that you're actually going into a preeclampsia. So you look at the ratio also of the SFLT1 and the placental growth factor, and if you find that this ratio is less than 38, so the SFLT and the placental growth factor, they have a high negative predictive value. It means that they have a higher chance, or they have they give you a reassurance that preeclampsia is not going to occur in the next number of days. So let's take, for instance, 7 days. So if you find that you have at least less than 38, your ratio here is less than 38, then the chances of preeclampsia not occurring, so that is why it is called having a higher negative predictive value, meaning that if it is less than 38, the chances here are very low of this woman developing preeclampsia in the next 7 days. Now, if you find that it is above 38, let's say 39 to about 85 here, so here you have about 20 to 22% chance of this woman developing preeclampsia in the next 7 days. And then if you find anything above 85 here, then you have over 50% chance that this woman is going to develop a preeclampsia in the next 7 days. So this also can be helpful in determining what type of a hypertensive disorder you're having, but it is most effective when done around about 20 to about 34 weeks. I think it can still be extended as well to about 37 weeks, but more effective and more accurate if it is done around that particular gestational age. So that is the SFLT1 and the placental growth factor. Now, you would also want to do obviously bloods as well. You want to understand so I'll just put bloods here. Obviously, you want to do the liver function test. You would want to do a renal function test. You would want to do a full blood count as well. And you can also do issues to do with clotting as well here. So if you're looking at the liver function test, you want to see, because when the liver is stressed and is undergoing massive damage, then the liver begins to produce enzymes. And if it is producing enzymes, you want to check, is the ALT raised, which is just alanine transferase, and then you have the ASTs as well, the aspartate transaminase. Are they elevated? Are they going up? So anything in terms of enzymes, or liver enzymes that is above 70 international units per liter. So anything above 70 international units here per liter then will be said to be elevated. And as you're looking also at renal function, okay, you're looking at the creatinine levels as well. If you're looking at creatinine, anything above 90 here, that is micromoles. Okay, anything above 90 micromoles then will be said to be elevated. If you're looking at urates, anything greater than, I think, should be 0.045 millimoles per liter. And then if you're looking at the blood picture or the hematological picture as well, you will then start seeing platelets coming down. This will be less than 100. Sometimes it will start as less than 150. If you start going to less than 100, then it means that you're now going into a severe form. It means that the platelets now are being consumed at a faster rate. You want to look at the clotting as well. When you do the bloods, you want to look at the clotting. What is the clotting time? You look at the prothrombin time as well here. What is the clotting time? Obviously, it is going to be prolonged. Why? Because there is obviously consumption as well of the platelets there. So there are a number of tests that you can actually run for you to arrive at having a hypertensive disorder of pregnancy. So these tests and activities that are done under the investigation for you to come up with a diagnosis come and are married up together for you to have a proper diagnosis and then manage this particular woman effectively. So you collect your history, you do your physical examination, you do urinalysis as well, and then you have your UPCRs there, the SFLT and the PLGF ratios as well, and then you look at the picture as well, that is the hematological picture where you look at the bloods. So basically those are some of the investigations that you can run for you to come up with a diagnosis of a preeclampsia, or for you to come up with a diagnosis of a hypertensive disorder, and for you to effectively manage that particular hypertensive disorder. There are a number of other tests that can be done, and especially with technological explosion, now we're able to do even more investigations in order for us to come up with these hypertensive disorders. But these are the basic ones that would also be helpful in understanding what hypertensive disorder you are facing. Now, if you found this particular video helpful in understanding some of those investigations or tests that we run in order for us to come with the diagnosis of a hypertensive disorder of pregnancy, don't hesitate to drop me comments in the comment section, like as much as possible, and send these videos, share them, share as much as possible. And if you have not followed the YouTube channel, it is the Brain Shakers Academy. Head on to my YouTube channel, follow, and hit the notification button so you don't miss any of this amazing stuff that we continue uploading right here. Thank you so much for your support and for watching, and I will see you in the next one.